softball, but then we'll be good.
Well, as my team can tell you, the chances of my being interrupted by one of my kids is high. Hello, everyone, and thank you so much for joining for this installment of our Ask an Expert series. Today's interview is with a birthing team from the Birth Center of New Jersey, and we are going to get answers to all of the questions you may have about delivering your baby at a birthing center. Also, importantly, I want to share that this week is Black Maternal Health Week, and the most important thing we and everyone watching can do is to listen to the stories and amplify the voices of Black moms and maternal health advocates across our state, which is why I am so excited about delivering. Welcome my guests today and hear all they have to share with us. With us today is Dr. Nicola Pemberton, certified nurse midwife MyQueesha lately, Michelle Gabriel-Caldwell, a doula, and April Knight-Copeland and Monae Idalis, Whitehead, both moms who delivered their babies at the Birth Center of New Jersey. So welcome, everyone. Thank you so much for taking the time to be here. Before we get to our questions, I just wanted to give everyone an opportunity to briefly introduce themselves, share your titles and where you're from. And April and Monae, we would, of course, love to hear about your backgrounds as well and how old your babies are now. So let's start with Dr. Pemberton.
Hello. Hi, how are you?
Just wanted you to introduce yourself briefly.
My name is Dr. Nicola Pemberton. I'm a board certified OBGYN. I originally did my training here in New Jersey almost 18 years ago. I currently am the medical director for the Birth Center of New Jersey. We've been open for almost 2.5 years, and happy to be here.
Thank you so much. How about MyQueesha? Can you go next?
Hi, I'm MyQueesha. I'm from Ohio. I am a nurse midwife, and I work at Artemis OBGYN as well as the New Jersey Birthing Center.
Fantastic. Thank you. Okay, Michelle, you're up.
Okay. Hi, I'm Michelle Gabriel-Caldwell. I am a birth doula, postpartum doula, and childbirth educator. And I am also the doula coordinator for the Birth Center of New Jersey, and I'm happy to be here today.
Thank you. And April?
Hi, my name's April Knight-Copeland. I'm originally from Washington, D.C., but I currently live in Somerset County, New Jersey with my husband. And I have a 15-month-old son, Noah, that was born at the birth center January of 2020. And I'm a digital content creator, and I'm happy to be here.
Fantastic. And Monae?
Hi, I'm Monae Whitehead. I'm a planning and zoning board secretary for the city of Elizabeth. I'm from Elizabeth, New Jersey. I currently live with my husband, Richard Whitehead, and we have an 8-month-old Teddy Theodore Jacob, who is just amazing, who was also born at the Birth Center of New Jersey.
Fantastic. Okay, wonderful. Thank you all again. And I think we'll begin with our first question, which is actually for Dr. Pemberton. So I think many viewers may not be familiar with the concept of a birth center. I'm wondering if you can walk us through what a birth center is and what exactly or how exactly it works.
Well, a birth center is really just an option for an out-of-hospital birth. Women who are looking for a more physiologic birth, natural approach, minimally invasive approach to their labor and delivery. And the birth center allows women to come to have again, physiologic labor and delivery, and have other options for relief measures, pain management, which does not include epidurals, and cesarean sections are not performed at the birth center. So this is for women who are considered low risk, healthy, both from the maternal as well as the fetal standpoint, and they're coming to have hopefully a normal, healthy labor and delivery. I believe you're muted.
I said, thank you so much. I'm sorry. Thank you so much for clarifying that, Dr. Pemberton. I think those are some really important details that may help some of our viewers in deciding where they might like to deliver. One follow-up question for you. Can you tell us what the criteria is to be able to birth at the center?
Well, first and foremost, low risk is a great general umbrella, but low risk means not having any medical conditions such as hypertension, diabetes, usually pre-existing diabetes before the pregnancy, or any gestational diabetes from the pregnancy that's managed on insulin. If there's any blood disorders, if there are any social concerns, anything that might be considered high risk from the perspective of the fetus, anything that's considered low risk from both the mom and baby, these are women who are considered eligible. Now, sometimes some women may unfortunately risk out if they develop things such as blood pressure or preeclampsia in the pregnancy. But otherwise, if they remain low risk up until the point of labor, then they are eligible to continue to come to the birth center for delivery.
Great. Thank you, Dr. Pemberton. It's so important to know what your options are when you are making a decision as important as this one, clearly. Okay, I'd like to ask MyQueesha and Michelle a few questions. First, there's often confusion between the roles of a midwife and a doula. I'm wondering if you can help our viewers understand the difference, please.
MyQueesha, you should go first.
I'm sorry, I had time.
You're muted.
Hi. So the difference between a nurse midwife and a doula, more certainly than anything, is the licensure. But we do a lot of the same things by supporting women, empowering women, as well as a nurse midwife, I can do more of the medical interventions for women. But as far as the biggest difference between a doula and a midwife will be more schooling and more licensure.
Right. I would like to just add that, to MyQueesha's point, I'm not a medical professional, but I'm a birth professional. So I understand physiologic birth. I understand the stages of labor, but I offer support in 3 forms: informational support, emotional support, and physical support. And I'm also usually the person that's continuously there with the family. So it's just the continuity of care that kind of adds and piggybacks on to the care at the birth center.
Okay, thank you. Great. Thank you for making the differences and the similarities very clear. MyQueesha, could you share with us why you became a midwife and why you chose to work in a birth center?
So I became a nurse midwife, one, because I was very interested in women's health. I was very passionate and compassionate about women's health. Of course, I became a nurse first and worked as a nurse for a few years, and then decided to go back to school for midwifery because I love the whole physiological birth as well as taking care of women on a daily basis. Other questions? And then when I was looking for different positions, I wanted to work for a birthing center or incorporate that into my skills and practice, mainly because of the natural physiological side of things. As in the hospital, things could tend to be a little bit more medical and interventionalized. So when I chose my position, I wanted to incorporate not only hospital, but natural births as well.
Makes sense. Thank you so much for sharing that with us, MyQueesha. Okay, I'd like to ask a question focused specifically on COVID-19. And this question is for everyone. How has COVID changed the way you provide care to your moms? Michelle and actually April and Monae, we'd love for you to share what your experiences have been during this time as well.
Hi. So as a mom, being pregnant, before COVID, you think your pregnancy is just going to go one way, and, you're going to have everyone around and, experience this whole journey with everyone. And then when COVID hit, it was kind of like, you have to separate yourselves. You have to, stay safe. So first, virtual everything, virtual meetings with the doctors, virtual tours and everything like that of the birth center, because I didn't even know the birth center exists until I walked into my OBG office, and I was just like, wow, this looks amazing. I definitely want to try this. But definitely having also that support from my doula, her coming in and, checking up on me, making sure everything was good, was also a good thing with this COVID thing happening, just to have somebody there. But yeah, it was definitely a change, but it ended up being a great experience at the end of it.
Great. Michelle, I think also you could probably chime in here and tell us about how your delivery has changed, your delivery of services.
Sure. So, initially, we're doing a lot of in-person meetings, post prenatals and childbirth education classes were all done in person at the birth center as well. And obviously when that hit, we couldn't do that anymore. So I had to change, really pivot to a virtual platform. And a lot of my tools and the physical things that I would use for training had to be converted now to PowerPoint. And I just knew that was going to lose, in translation, the information that I wanted to share with clients who wanted to birth there. But, I think, everybody understood, everybody recognized, and they felt actually very safe that, okay, yes, I'm still getting this information, even though, it's COVID. So I think that transition was probably more of a headache for me than it was for the actual recipients, because they still garnered what they needed in order to have a happy and safe birth. As far as doula work goes, initially it was kind of hard, right? Because there were moments when I didn't know if I would be able to accompany my clients in the birth center space. But thanks to Dr. Pemberton and her husband, Kamante Howard, they were like, "Whoa, you were before your husband, Mrs. Murphy, said that doulas were essential." They were like, "Doulas definitely have a place here." So that was certainly something for us that made that transition a little bit easier. And I was, graciously able to support Monae and April during their births through COVID. So a lot of our pivoting kind of worked, and it was almost seamless in a really kind of bizarre way. And one of the other things that I did outside of the birth center was to create a virtual doula platform for Overlook Hospital, because we knew that there's a possibility, of transfer of care there, and that needed to be continuous as well. So just creating that, not just for birth center patients, but for anyone who needed some help in those times. So I think we were pretty successful and impactful with moving through, the virtual piece. We're still teaching our classes virtually right now until everybody gets pretty comfortable in, being together in that one space.
Thank you. I'm not sure, actually, April, I'm not sure if you actually had your baby during COVID or previously. I think I misspoke because I believe you had just before COVID. But if you have anything you want to add, or Dr. Pemberton or MyQueesha, please jump in.
Yes, I had my son in January of 2020, but I experienced the early stages of my postpartum at the height of COVID. And I will definitely say that even though I didn't have my pregnancy during COVID, having my doula, Michelle, there to support me in just after giving birth has been really essential because, as Monae said, we had to self-isolate, especially because I just had my son and he was not even 9-10 weeks old at that point. So it really went to full isolation mode, and just having that continued support of Dr. Pemberton even afterwards, and the doula, Michelle, was just really impactful in how my recovery went in the early months of COVID.
Makes sense. Dr. Pemberton or MyQueesha, would anything you want to add before we move on?
Yeah, everything, just to piggyback on what my patient said and what Michelle said primarily. It was a little bit of a headache, but the key was trying to make sure we could keep the care as much as we could continuous, but we wanted to make sure everyone was safe, patient safe, baby safe, doula safe, staff. But we did not want to, have a break in what we were doing. We did take all the necessary precautions as New Jersey State, including the hospitals. So we did follow some of those guidelines as well. But we did want to make sure that our patients did not have a disconnect as a result. We wanted some normalcy in a time of absolute pandemonium, so to speak.
Great. MyQueesha, anything you want to add?
Yeah, so I came in when during the pandemic. So I would say COVID, changed the care as far as virtual visits. But I also thought that was great that we were able still to provide some type of healthcare virtually instead of no healthcare at all. So just coming into the phase of virtual visits, I thought that was helpful.
Fantastic. I thank you all so much. There's always so much uncertainty around pregnancy and childbirth in normal times. So I know the added worry of COVID-19 has really heightened that feeling. It's great to know there is a plan in place to minimize risks. Okay, switching gears a little bit. This question is actually for everyone. Again, as many of you know, and many of our viewers know, we have horrible birth disparities in New Jersey when it comes to race. How do birth centers help mothers have better birth experiences and outcomes, especially our mothers of color?
I guess I'll start, and I'm sure everybody else was gonna continue on the same. We're gonna be pretty much saying a lot of the same things with different aspects of it. But the whole purpose of the birth center or birth centers in general is my biggest concern as a provider and a woman of color. Having worked behind the Iron Curtain, I have seen those levels of bias on the side of a provider during training and even after. And when having graduated, having had more experience under my belt, it gave me an opportunity to say, we can do better. I know it's a very unique path that I'm traveling, because I know that a lot of my colleagues, some of them think that I fell and bumped my head, but nonetheless, I'm really happy about having made this choice, as a lot of it is comes full circle for me in my history, but being able to offer this to women in general, but women of color in specific, being able to offer this choice and be able to empower our women to have the options that may not have been seen as options before, and give us an opportunity to educate, because I feel like a lot of women who don't have this exposure, this access, are not even aware of the choices. So I'm happy to be a part of what we're trying to do here with reducing morbidity and mortality among women and Black women and now Black babies, just one baby at a time if we can. I try to practice minimally invasive gynecology, but I also try to practice minimally invasive obstetrics, whether I'm in the birth center or in the hospital. So we try to find ways to have healthier outcomes, which starts from it's a team effort. It's, I might be here from the prenatal standpoint and education, but as you can see from the group that we have here, it's a team effort. Everybody is of a like mind. And I know I can't do this on my own, so that the people we're talking to today are really a part of what we're trying to do when it comes to reducing this morbidity and mortality in general, but specifically in the state of New Jersey.
Thank you. And anyone else? MyQueesha? Michelle?
Just to piggyback off of Dr. Pemberton, again, the education portion of it helped us to have better outcomes, but also just being able to listen. Sometimes, I mean,
I think we
lost her.
lost her. Do you want to pick up?
Okay, I'll pick up.
Okay, perfect.
So I think, one of the things that the birth center does do well is this whole space for all Black persons and all women of color. And I mean, it's really sort of I want to call it like a big hug, when you walk into that space and you see that, not only is my doctor Black, but my midwife is Black, and my doula is Black, and my nurse is Black. I mean, it's just, representation matters on so many different levels, and being able to connect, not just from a cultural lens, but also a sisterhood in a space that says, you've got this, you can do this. I mean, so many of my clients are obviously just in love with Dr. P because of the way she just sits and listens, and really allows that person to spend the time in her office just asking whatever questions they want, and just having regular conversation. And she's sought after because of that. And I know that I'm, sort of just big up in her, but she deserves it. And she won't do it herself. That's why I'm saying it. I know I see her over there shaking her head. But the thing is that, this is why we work so well together, is because we do come from the same kind of playing field. We want the same outcomes for everybody that walks into that space. And when we're talking about, providing them all of the tools up front they need, making sure that they're in childbirth education courses so they know exactly what to expect. They understand informed consent. They understand what their rights are. And, knowing that, yes, they have chosen a birth center, so there isn't going to be like this huge fight, for a lot of things because of that space in the first place. But on top of it, it's just, I've got this team that's supporting me. I have this team that looks like me. And so from a health equity perspective, that is the goal of leveling the playing field.
Thank you. That was really helpful. MyQueesha, I know you kind of got cut off, so I don't know if you want to add anything in here, but please do if you'd like to.
I think I was done.
Okay. All right. Well, thank you all for that. And Dr. Pemberton, it's nice to know you have someone in your corner who's rooting for you. You've got a great team, it seems.
Well, yeah. I do want April and Monae to add their comments as well, if they can.
Okay.
To the
Perfect.
health equity piece.
We'd love that.
I would just like to say, piggybacking off of you guys, that the evidence, and the information that I've gotten that I never would have gotten before that. I've said this to Michelle before. I've seen, my sister have a birth in a hospital, and just kind of things being told to her and not knowing, and just, you're a doctor, you know what you're doing, you do it, go ahead. Where when I got these courses and knowing the things, I was just like, wait, what? Like, you can say no to them. You can have a choice, like, to do this or to do that. So it was a great way to like calm down my fear, because with a lot of things you just think of it being one way and one way only, and not having a say in a lot of things, or just it all coming at you at once. I don't know. It was just a lot of fear with just being pregnant, the baby coming, not knowing how he's coming, all that stuff. And just having someone to calm you down and tell you, like, no, it's okay. Like, this is what's going to happen. This is why you're going to feel this way. And you can do this. You have this choice and this. And it was just amazing evidence, and the statistics on also what happens, with colored women in hospitals, or, just, I didn't have any idea about that. And, coming from a Black family, I was just like, wait, what? Like, this is this is all new to me. I don't want that to happen to me. So I'm glad that I went this route and I got this information, and it was awesome.
Fantastic. April, anything you want to add?
Yes, absolutely. I would definitely say that, especially for my husband and I being first-time parents, we don't have any experience with like nieces or nephews. So going through the birth center route just allowed us to really feel comfortable voicing our just fear, our knowledge of what we know, what we don't know. And then the fact that they actually educate you on, this is what's going to happen. This is why it's going to happen. This is why you shouldn't be afraid. And just having another option outside of what you've heard or seen just everybody tell you, like you have to give birth at a hospital. It's like, no, there are other alternatives. And this is another choice that you'll still get the birth that you want, but now you'll feel more confident because you know why you chose this, and you'll know exactly what part of labor you're in and what happens afterwards. So it's just, for me, being like the first person just in my circle giving birth, it was just really important to make sure that I knew what was happening, I knew why it was happening, and I had more control over, as much as I could, of the choices that I made for myself and the baby.
Well, I thank you all for weighing in there. Really helpful. Our maternal health initiative, Nurture NJ, is laser focused on improving health equity. And we are so grateful to all of the many stakeholders across the state who are committed to partnering with us to solve our maternal health crisis here in New Jersey. Okay, so this question is also for everyone. What are some challenges you have faced as a birth center or as a mother choosing to deliver at a birthing center?
I guess I'll start. Sometimes, again, a lot of it is perception. And sometimes that perception can alter people's perspective. From a provider standpoint, I know a lot of the times I've, again, trained in hospitals where C-section rates are pretty high. So C-sections can be done with timely precision. But to give a woman a chance to let her body do what it does, sometimes you meet resistance. And as a provider, to meet that level of resistance, it's kind of surprising and disappointing. Over time, I felt knowing that these women would have the less invasive outcomes and be able to feel a little more empowered after their deliveries, I became a little more confident in being able to give that woman that choice despite the opposition. So some of the times, even with the birth center, it seems what my concern is being able to make sure women have universal access. I feel like we need to have women have a lot more access to a birth center, and know not only for the ones who may be in a better financial position, just not the ones who have an educated stance or pre-knowledge about birth centers. It should be for individuals who never even heard of it, or don't always have the funds to be able to say, okay, well, I'd like to deliver there. What can I do? And not be told you can't because you just don't have enough. These are things that we are trying to do the best we can to change. And I know that's some of the things that might make it a tough climb, but a climb I'm willing to continue if it means women can have a lot more access regardless of their status, their race, their background.
That's great.
And I'd have to agree with Dr. Pemberton. I feel like the biggest challenge that I face as a provider or see as a provider is, one, the patient just not knowing, so not being educated, not even knowing what it is, but also being open to, once you talk to them about the birthing center, they're like, oh my gosh, I never knew that existed. Like, what can I do to be a candidate? But also the lack of access. Again, as Dr. Pemberton mentioned, patients want you to deliver in the birthing center, but they just don't have the funds to. So I think those are the biggest challenges that I've seen.
Michelle, anything you want to add?
Yeah, I'd like to add a couple of things. So I think it's just perception of what we do at the birth center too is also a little bit of a challenge, right? I mean, folks kind of think of birth centers or people who are birthing at the birth center as just these real crunchy, tree-hugging kind of people or something, right? So it's just, the viewpoint and that lens of who can birth there, or and who should if they want to. And then going back to the access piece, the inability to afford that. Even if you decided to make that choice and said, okay, that's the way I want to birth, right? And but if your insurance doesn't even view this as, something that you can use or provide, or you'll have a huge out-of-pocket expense because of it, or it's not in network, or et cetera, right? So all of these things that fall into limiting access, I think, is a huge challenge there. And then again, the fact that a birth center isn't a 24/7 operation like a hospital space. And so even when you get someone who has qualified from a low risk standpoint, just they're still in this, it's a hospital kind of thing, right? So they're really not kind of focusing on the fact that I've got to call people before I just show up to the birth center. I've got to let them know that, I'm coming. Or conversely, with people who don't have an affiliation of a doctor or a midwife at the center, who think, oh, well, there's a birth center down the street, then we're just going to go there and have our baby, right? Without recognizing that there's, a real, what's the word I'm looking for? You have to be attendee. I don't know. What's the word, Dr. P? You're looking to be part of this. If you're a physician or a doctor, and you have to be part of the birth center.
Right. To be credentialed, have privileges.
Great. There you go. To have privileges. That's what I was looking for. And so those are challenges as well, because people, don't have access to the birth center because their physicians or their midwives aren't interested in having access or privilege there. And then the last piece is, of course, as a doula, I have, oh, well, you know what? There's the birth center there, and I haven't attended a birth, and I need to just shadow. And so everybody thinks that they could just come and show up and sit in the corner and watch a birth. And that's like not, that's no. Birth is a sacred space, and that's, you have to be invited into that space. And so we're not doing rounds. We don't have students coming in and all that kind of stuff. So I think when we look at what are the challenges, it's just not really understanding the function, of how we work and how we operate and what are some of the requirements. So I think that's just from my viewpoint. And thanks out for that word. I was tongue-tied there.
Great. April or Monae, you want to add anything here?
Yeah, I would love to add. My, experience with the challenges that I went through in the beginning definitely were, family support on this decision. My father automatically, said, no, you should have it at a hospital. You'll be safer. There's doctors there. And I'm like, there's a doctor there too. I don't understand, but it's just them not being educated on, birth centers and what they actually do and what they provide. And it's the lack of knowledge. That's all it is with the family, so for them to have lack of knowledge just kind of just shifts to, no, I want, my baby girl or, my family member to be safe. I want them to go to a hospital, but, you don't understand that I am safe here. I have people who are looking out for me and my baby, it's more intimate. And it was just, that was the biggest challenge that me and my husband went through on both sides of the family. But after we kind of just broke it down after all our courses and everything, it's kind of like, what, we know what we're talking about. We got this. It's okay. We're going to be fine.
Great. April, anything?
I would definitely agree with Monae saying that it was lack of family support. My family still lives in Washington, D.C. My husband's family lives here in Jersey. And so when I first talked to them about going this route, they were afraid because they didn't even know what any of this was. And then I mentioned talking about getting a doula. So they were just like, oh my goodness, like, what is all this you are trying to do? And so I will definitely say that the shift happened once they were able to experience it in person, especially my mom was able to actually see it. And then that's when now she tells everyone. So it's really just a lack of just knowing what it is, and they don't know anybody else who's done it. And so that's really where I think the misconception comes in, because no one knows what it is. And then you add like a doula or like a midwife, and they don't know what that is either. So it's just the education piece, and then feeling comfortable once you tell them and lay it out. That's where like the light bulb goes off, and they're okay with it at that point.
Great. I think you're right. So the perception, the cost, the planning, I love that. The fact that you're not 24 hours there, there's a lot of pieces in there, and then making sure that people will support you. All obviously really important. Thank you, everyone, for that. Information is key in helping mothers make the best choices. I can admit that I am very eager to hear your answers to this next question. What can the state of New Jersey do to ensure more mothers have access to birth centers? Dr. Pemberton, maybe that's one for you. I'm not sure.
I guess from my standpoint as a provider, I can't really say what you should do specifically, but if there's a way, what I would desire, what I think anyone on this panel would love to see is increasing that access. I mean, making it a lot more accessible, not just to the favorite few, the ones who actually did their research, the ones who were knowledgeable about it, who just came to our office one day and saw the birth center next door. It should be to communities that didn't even know this existed. And that includes being able to access it have access to it without having to say, let me look and see what I have for funds. That means insurance companies need to be a little bit more on board. Birth centers do have staff to pay. We do have labor and delivery nurses. I do have midwives, and doulas are independent. And yet, as a team, we'd love to see this birth center continue to service this community. And in order to do that, it shouldn't be such a battle for patients to be able to say, if I'm low risk and I meet the criteria to deliver outside of a hospital setting with all these qualified providers and birth supporters and birth workers, why should I have to say I have to decline that option because I just don't have access or insurance or finances because of my insurance? So from my perspective, that would be what I would love to see change from the state of New Jersey.
Thank you. Michelle, MyQueesha, anything that you want to add there?
From my end, I'm always about the education. So for me, if there's a way that the state is able to create a program or an advertisement or even a commercial, that says, hey, birth centers exist, check them out, and give like a FAQ or something like that that's just like rolling down under the screen or whatever, so that people are aware that there are, birth centers that exist in New Jersey and what they can offer and who qualifies. And so there isn't just this happenstance of whether or not you figure it out or somebody, by word of mouth, you heard about it. And of course, the onus is on some of the birth centers to do their own personal advertising too, but I think the state can help in that education for it.
Great. Okay, MyQueesha, anything to add, or we covered it all?
I would just agree about having just more access. Again, like I'm from Ohio, so I came from Ohio, so I'm still learning more about New Jersey, but I would just say access for sure.
Okay. Well, by the way, we're really happy you came from Ohio. I just would throw that in there. So that's really helpful. I know that my team is listening and taking notes as we work to implement our Nurture NJ strategic plan. Feedback like this is really so invaluable. So thank you. I have a couple.
I have one more.
Oh, sorry. Go for it.
I just thought about something else. What about incentives for other physicians to also, care for their patients at the birth center? Like, I think the more, doctors have access to, the center and see that that's an option for them as well, I think we get more people into the doors.
Right. Just to piggyback, I'm sorry not to interrupt, but she made that correctly. We've tried as a provider, I've reached out to other colleagues, and I don't want to pretend I have all the time and the space in the world to deliver every patient that's interested in the birth. And I'm not really trying to hoard those patients. I'm really trying to expand it by allowing not only the patients to have their own providers, if their providers are interested in becoming credentialed at the birth center, that would give the patients the comfort of their providers, but also being able to say, yeah, they're getting the choice or the option of an out-of-hospital birth with their credentialed provider. Also, again, going back to access, we are trying to, since the New York Times tried to create a fundraiser to allow women as a scholarship to be able to have access to the birth center. If they are in a need financially or from an insurance perspective, just don't have that opportunity to have the beautiful births that we want to be able to create here for every woman. We want to be able to create that level of access by creating a fundraiser saying, let's give scholarships to women who are deserving, and be able to say, let them have the ability to be able to have a beautiful birth and healthy and safe birth as well, which includes having an excellent doula by their side.
Thank you all so much for that. I know that time is running out. I am going to make the leap of faith that April and Monae would both go back to the birth center again and deliver another baby. And so I think I want to just quickly do one quick buzz around and see if anyone can tell us kind of how your delivery experience at the birth center has changed the way you've educated your immediate family, and about what they might want to consider as they move forward for birth options. So April and Monae, if there's anything you want to add there, that'd be great.
Well, I'm just glad that I got the education from this experience, and just also feeling like the whole thing, going through the whole experience, also taking the courses that I could pass on to my friends and family, that now they could have the options and the choices that I have. Even if they decided to do it at a hospital, they can at least know and take it in and make the choice for themselves, So I'm just glad to provide that for them, even if they didn't go to the birth center and have the courses that I had. But I have the knowledge now to at least say, hey, I just want to let you know this and, this, but it's still your choice, But I'm glad to be that person for my family and friends.
Yes, absolutely. I think even for my family and friends, they now have a person who has been through the experience, so they're less fearful, and I'm able to kind of guide them. Like I said, I'm originally from DC, so I guide them to finding resources in their area of how to go about doing it, and they've actually started telling more people, and it's just really started to open up just the avenue of choices that we have outside of like the traditional hospital route if they want.
Thank you both for that. I think you have cleared up a lot of questions that pregnant moms who are watching may have had. And I really want to thank all of our guests for joining us today and for all you do to support New Jersey's moms and babies. I think we could easily have spent an hour on here, but unfortunately we're running out of time. One of the most important aspects of Nurture NJ and our strategic plan is its emphasis on partnership across industries, academia, healthcare, government, communities of faith, and more. And I am really grateful to all who have partnered with us to get this message out and to help solve our maternal health crisis, especially this week during Black Maternal Health Week. Together, we will make New Jersey the safest and most equitable place in the nation to deliver and raise a baby. Listen, before we go, I want to urge anyone watching to share this conversation on your social media. We have an entire series of Ask an Expert episodes, and you never know who you may be helping. Thank you, everyone, again, and have a terrific Black Maternal Health Week.
Thank you.
Thank you.
Thank you.
Thank you.